Hello, and welcome back to the healthcare policy training on preparedness for emergencies for healthcare. And this is session 2, managing and reporting infectious diseases. Caregivers are required to adhere to licensing regulations when responding to outbreaks of contagious diseases and illnesses, ensuring the health and safety of both children and staff. Children who exhibit symptoms of the following types of infectious diseases, such as gastrointestinal, respiratory, and skin and direct contact infections, may be excluded from the center if it's determined that any of the following exist. So this is a more in-depth, kind of a different one than the flu. Some are similar, some symptoms are similar, and some are different. So, fever, diarrhea, or vomiting within the past 24 hours. Symptoms that prevent the child from comfortably participating in activities. If we see the child is off that day, one day, and they've just been going on and on for hours and they're just not acting themselves, we can call the parents. Symptoms that require care beyond what the staff can provide without compromising the health and safety of children or other children. Mouth sores, unless the physician states that the child is non-infectious. Rash with a fever or behavior change until the physician has determined that the illness is not a communicable disease. Purulent conjunctivitis, defined as pink or red conductive with white or yellow discharge, often with matted eyes, until examined by a physician and approved for readmission with or without treatment. Tuberculosis until the child is non-infectious. Impetigo until 24 hours after treatment has started or all the sores are covered. Head lice, free of all nits and scabies and free of all mites. The child has any following conditions: fever, unusual lethargy, irritability, persistent crying, difficulty breathing, or any other signs of serious illness. And strep infection until 24 hours after treatment, and the child has been without fever for 24 hours. Many types of hepatitis are caused by viruses. The symptoms are so alike that blood tests are needed to tell them apart. So in the US, most common types of hepatitis are A, B, and C. Types B and C are spread through blood and other body fluids. Type A is spread through contaminated food and water and stool or feces. Fact sheets are available from the State Department of Public Health if there's more information needed for this area of illness. Chickenpox until the last blister has healed over. Symptoms which do not require exclusion, and this is stated by the EEC. Common colds and runny noses. A cough not associated with fever, rapid or difficult breathing, wheezing, or cyanosis. Daily health checks should be conducted upon each child's arrival to assess their well-being. So staff should objectively determine whether the child appears healthy or ill. Always check. Meet the parent in the hall, one teacher, and please check the child. Staff must evaluate which child with mild illnesses can remain in care and which need to be excluded. So this is an important role. Again, we're all taking roles in this. If a child develops new signs or symptoms of illness, staff will inform the parent or guardian. Immediate notification is required for emergency or urgent situations. Again, if the child has diarrhea once, I will notify the parent. They don't need to pick up, but then if it happens again, they need to pick up. Parents or guardians should be promptly notified if the child exhibits symptoms that warrant exclusion. And they should arrange for the child's removal from the childcare setting as soon as possible. A child who has been excluded from childcare may return after being evaluated by a physician, physician's assistant, or nurse practitioner, and if it has been determined that he or she is considered to pose no serious health risk to him or her or to the other children or staff. Nevertheless, the daycare center may make the final decision concerning the inclusion or exclusion of the child. Again, it's up to us teachers to prevent or accept the child coming for that day. If a child has already been admitted to the center and shows signs of illness, for example, a temperature above normal or greater than 98.6 degrees or 37 degrees Celsius by the oral or auxiliary route, a rash, reduced activity level, diarrhea, etc., he or she will be offered their mat or cot and other comfortable spot for which to lie down. If the child manifests any of the symptoms requiring exclusion as listed above, or is determined that it is the best interest of the child that he should be taken home, his parent will be contacted immediately and asked to pick up the child as soon as possible. For children with symptoms that do not require exclusion, it's acceptable to notify the parent or the guardian verbally or in writing at the end of the day. So they should be let known. Just give a heads up. Let them aware of what's happening. For children with symptoms that do not require exclusion, it's acceptable to notify the parent or guardian verbally or in writing at the end of the day. Most conditions, or even during the day through a text. Most conditions requiring exclusion do not necessitate a visit to a primary health care provider before the child can return to care, except for the ones that I had mentioned that needs a doctor's note for them to be returned. When a communicable disease has been introduced into the center, parents will be notified immediately and in writing by the program director. Whenever possible, information regarding the communicable disease shall be made to the parent. And of course, we won't say who the child is or who the parents are, but we will say that this disease has been in our center, and to give you a heads up, this is what's happening. You may choose to return to the center or stay away. Reporting requirements for contagious illness of a child. So we do have reporting requirements as we're licensed under the early education. The contagious illness of a child is a reportable condition required by the Department of Public Health's Division of Communicable Disease Control. Infectious diseases that require reporting include any disease that's preventable by a vaccine, as well as botulism, legionellosis, invasive meningococcal disease, norovirus, and tetanus. Call infectious disease surveillance, reporting, and control infectious disease emergencies at 617-983-6800. And this will be done by myself or Natalia. So please report to us if this happens. I think we'll know, but remind each other and talk about it. Should this be reported? Is this an infectious disease that needs to be reported? And we'll do so. So the Bureau of Infectious Disease and Laboratory Sciences is part of the Mass Department of Public Health, Division of Epidemiology and Immunization. 617-983-6800, day, night, or weekends. Or online, we can fill out a form. It's called the EDS-SBRF, Gastrointestinal Pediatric Cluster Reporting Form. This form includes the report date, the facility name, the facility type, the facility staff and children in attendance, symptoms of illness, laboratory information, and control measures. And then there's an infectious disease case report forms. And these forms are forms for the following illnesses: e-cigarette or vaping associated lung injury, COVID-19, chlamydia, gastrointestinal illness clusters, gonorrhea, hepatitis B, HIV/AIDS, influenza respiratory illness, neonatal, syphilis, tuberculosis, and varicella. The on-call epidemiologist is available during normal business hours for emergencies and to answer questions regarding case investigation and the implementation of control measures. He or she is available at nights and weekends for emergencies only. Program directors shall consult the Child Care Health Manual for such information. DPH must be contacted when there's a reportable communicable disease in your program. In all my years of experience, I have not had one yet. So it'd be nice to keep it that way. Plan for mildly ill children. And there will be mildly ill children in our classroom, or there have been. Children who are mildly ill may remain in school if they are not contagious. We refer to the Plan for Infectious Diseases. And they can participate in the daily program, including outside time. They have a runny nose. They have a sporadic cough here and there. They have a stomach ache that's short-lived. If a child's conditions worsen, or if it's determined that the child poses a threat to the health of the other children, or if the child cannot be cared for by the classroom staff, the program director will contact the child's parents. The parents will be asked to pick up the child. The child will be cared for in a quiet area in the meantime, a classroom, or in the center's office by the teacher, qualified staff member, or by the program director until the parents arrive to take the child home. Any toys, blankets, or mats used by the ill child will be cleaned and disinfected before being used by other children. First aid transportation to the hospital. At least one staff member presenting on premises is trained in first aid, including first aid for infants and young children. For our first aid kit, it complies with health and safety first aid regulations and is regularly checked by a designated staff member and restocked as necessary, and is easily accessible for adults and kept out of children's reach. Our facility is equipped with an AED. Upon admission, parents provide written permission for emergency medical advice or treatment. They sign and date their consent. This is the registration or enrollment forms that we have them on file. We have them both on digital file as well as physical file in the file cabinets. If there are any that do not sign or consent, that list will be separate, but right now they all consent. Parents also sign a consent form at registration, allowing staff to take their child to the nearest accident and emergency unit for examination, treatment, or admission as necessary, with the understanding that parents will be informed and are on the way to the hospital. In the case of an emergency or illness such as a seizure, a serious fall, or a serious cut, the teacher in charge will begin administration of emergency first aid while the assistant teacher or second teacher takes other children to another area of the room. Both staff members should respond in a calm and reasonable manner. In other words, don't alarm the other children, or be sure to calm down the other children. Other staff will be alerted to send for assistance, be it the program director, another person at the center, Natalia, Natasha, myself. One of the supervisory staff will contact the parent to come and pick up the child, or, if response time is a factor, to have the parent meet the child and accompanying staff at the emergency room of the hospital utilized in emergencies. So we'll be in direct contact with the parents. If the EMS happens to come to the building and the parents want to come to the building and ride with the child to the hospital, that's fine. Or the parents can just meet the vehicle and their child at the hospital. In the event of situation arises that is life-threatening or the child cannot be comfortably restrained in a car, an ambulance will be called immediately. So that's another factor that we have to think about if there's an emergency. Can the child be, restrained in a car seat? Can they sit up that way? Is there anything else going on? So then we definitely call the EMS. The parent will be called to meet the child and staff at the hospital. The teacher or other designated staff will go along with the child in the ambulance. The child's file will be taken, including permission forms and pertinent insurance information if the center has it. So typically at enrollment, again, we take insurance information. So we must grab the child's file out of the file drawer. Best using that one than the digital file. Otherwise, we do have the access to the digital file on both my work cell phone and Natalia's work cell phone. When parents cannot be reached, those listed on as emergency contacts will be called as a further attempt to reach parents. In the event a parent cannot be reached immediately, a designated staff person will continue to attempt to reach parents. If necessary, the child will be transported to the hospital by 2 designated staff members, if we have the ratios, or by ambulance, and the child's whole file will be taken, including permission forms. The program will immediately report to the Department of Early Education and Care any injury to or illness of any child which occurs during the hours while the child is enrolled in care and which requires hospitalization or emergency medical treatment. We're going to sign off right now, give you a little break, and we'll be back for session 3.